and the use of robotics for colon surgery.
Yeah, which is a big change from the way it was maybe 5 or 10 years ago, isn't it?
It's a huge change, and the typical colon cancer surgery, you have an open operation, you're in the hospital 1 to 2 weeks, your bowels shut down, and it's a lot bigger recovery, and a big incision is a lot more painful and takes a long time to get back to normal activities. Whereas with colon surgery done robotically, you're out of the hospital within 2 to 3 days and back to fairly normal activities in 2 weeks.
Yeah. Boy, that is a huge difference.
Yeah.
So let's talk about it. Colorectal health. The commercial even says, as we wrote it, it's preventable, it's treatable, it's beatable.
Right.
Prevention. Let's talk about that aspect of it first.
Well, prevention, everybody thinks, well, why should I go? I feel fine. And the problem is by the time you have symptoms from colon cancer, it's usually advanced. And so, the American Cancer Society and all the other great groups recommend getting a baseline colorectal screening at age 50. Mm-hmm. And the most widely accepted screening for that is a colonoscopy. Okay. And, I had mine, and, it's actually a relatively easy thing to go through. The prep is probably the worst part about it.
Everyone tells you that, and they're right.
But, people go to pay for colon cleansing, and I always laugh. I said, come to my office, I'll give it to you for free.
That's a side business.
That's right. So, but having a colonoscopy will detect polyps, and polyps can be removed and treated, and you never need surgery. And so, and before they ever become symptomatic or develop into a cancer.
Mm-hmm. That's why they call them pre-cancerous polyps.
Right.
But in order to prevent them from moving from pre to actual cancer, get rid of them now.
Right. And we know that, it's not like it's a doubt that they become cancer. There are microscopic findings in the polyps that they are precancerous, and if left there, will develop into colon cancer.
Yeah. Okay. So, guys, gals, all.
Everybody. And that's if you have no family history.
Yeah.
And I do, the genetics for breast. I also do the genetic testing for colon cancer as well. And if you have a family history of colon cancer, it's just like mammograms. It's 10 years younger than the youngest person in your family with colon cancer is when you should have your colonoscopy. Okay. So, Katie Couric's husband died from colon cancer in his early 40s. Mm-hmm. So their children, she's very much a big colon cancer advocate now. Jimmy Kimmel was getting his colonoscopy live on TV with Katie Couric, and those types of things really help. It gets the advertising out there.
Yeah, get the information out there, and you're right. The process itself is a very simple one from the patient standpoint, but you as the surgeon, Dr. Billen as the surgeon, and others, you know how delicate an operation that can be, and that's where the robotics come in, isn't it?
Right. The robotics is, just the delicacy of the operation is exactly it. It's not as a rough of a procedure when you don't have the big incision, and you can go in and, with the wristed instruments, we've talked about robotics here before, the optics are better. You have 10 times magnification with depth perception, so you have 3D vision, and you can go in there with wristed instruments, so it's like having little hands down in there where we can reach around things, and so we don't have to open up the belly to be able to manipulate the bowel, and we can actually manipulate it even better than open a lot of times.
Now, through the month of March, we're going to have you and I assume Dr. Billen
right.
and maybe others, I don't know, on the air with us each week. And we're going to talk about colorectal cancer and the dangers and how we can prevent it. And there are a number of different prevention techniques, aren't there?
Right.
The screening that you're talking about certainly is one of them, but there are things that we can do lifestyle-wise.
Yeah, lifelong habits. We talk about protein, as we were saying, and red meat, has been associated with an increased risk of colon cancer. I'm not going to sit here and advocate, give up your steaks. I like a good steak as well, but everything in moderation, moderating a good diet, a high fiber diet, we don't really know the cause of colon cancer. We know there is some genetics, but that's a very small part of colon cancer, and we think it's the exposures of toxins in your stool to the lining of the colon. So having regular bowel movements and having regular good colon health, which the best thing for that is high fiber. And high fiber will help the stool move more easily through the colon. The thought is that it will bind toxins as well. So a high fiber diet has been shown to decrease the risk of colon cancer. There's some other data out there that suggests, an aspirin a day, a baby aspirin a day will decrease the risk of colon polyp formation. Now, I don't want to advocate going on aspirin unless you speak with your physician, because it depends on your other underlying health issues. But an aspirin a day sometimes is beneficial as well.
Yeah, absolutely. So that is a part of, I'm assuming, what we'll be talking about when you do the screening event. Tell me about what's going to be happening at the event itself.
Well, the big news at the event is we're going to have the robot there. So you'll get to see the surgical robot at the event, and you'll actually be able to sit down and use the robot. They have the Intuitive Surgical is the company that makes the Da Vinci robot, and it's not our robot that stays in the operating room.
Sure.
This is the one identical to ours that travels to events like this, and where the public can come and sit down and actually use the robot and do some different techniques on the robot, moving some coins around and putting rubber bands around things and everything, and you can actually get the feel for how responsive this is, and it really increases your appreciation of it when you see that. And then both Dr. Bill and I will be giving short talks on colorectal cancer and, about the prevention and the things you can do. And also we'll be talking about colorectal surgery and, talking about using the robot for colorectal surgery.
Dr. Dan Clark is with us from the IRMC Physician Group. We're talking about a colorectal scanner or cancer screening event that is going to be coming up later in the month of March. And as we enter into this month of March, we don't want to scare people, but we do want them to be quite aware that colorectal cancer is the second leading cancer cause of death in America today.
Yeah, and people don't understand that, because it's a silent killer. Like I said, by the time you have symptoms from it, you have a blockage, you have a huge tumor in there. And unfortunately, associated with that is often spread to the lymph nodes and spread throughout your body, such as, the first place it spreads to is the liver. And it's much more difficult to treat and cure it at those stages. The survivals go down dramatically if it's spread outside of the colon.
Yeah.
So if we can get it while it's still in the colon, and if better yet, if we can get it when it's a polyp, and then it's not even a cancer, we can prevent colon cancer. And it's a simple, easy test to do. There are, blood tests. There's, you hear the a lot of commercials now about Cologuard, where you test your stool. And that is a genetic test of your stool, actually, that looks for cancer genes in the stool. I'm not sure about the insurance coverage for all that yet. It's not widespread, but there's a lot of simple tests that can be done to help decrease your risk.
Yeah, and certainly we're going to learn about that at the event.
Absolutely.
And how that works and the other things that we can do. But really, we need people to understand the need for the colonoscopy.
Right.
Yeah.
And that's the number one test. It's the gold standard. And at age 50, if you don't have any family history, that's when you should get the colonoscopy done. It's an outpatient procedure. You go to sleep, you don't remember it. Some people want to watch. I'm not sure. I didn't want to watch mine. And so, and it's not a general anesthetic. It's a sedation. So, you don't have to have a tube down or anything like that. They give you some sedation. You undergo the colonoscopy. They can remove the polyps. And, we found some cancers in people that never had any idea they had it or had any family history, like you say, because it's the second leading cause of cancer death in this country.
Yeah, and afterwards people tell you, oh, you were talking the whole way through the procedure. We were asking you questions and everything.
That's right.
I don't remember any of that.
Right. Yeah.
But absolutely, this needs to get done. So people want to register for this event. They need to call ahead of time, yes?
Right. Yeah, the number to register is 724-357-8088. It's going to be at the Rustic Lodge March 18th. It's my daughter's birthday. I shouldn't forget that. So March 18th at 6 p.m. And again, call 357-8088 and register for it and get to sit at the robot and use it and hear Dr. Bill and I give a discussion. We're going to have other people there as well discussing things too.
Absolutely. Dr. Clark, thanks for coming in. And we look forward to this month of March where we're going to continue to focus upon colorectal health.
Sounds good.
Appreciate it.
Thanks for having me.
It is the voice of Indiana County, WCCS AM 1160 and 101.1 FM.